Good morning, ladies and gentlemen. It's my great honor to be here. My name is Jun Yan from Nanfang Hospital, Southern Medical University, Guangdong in China. Today, I would like to present my study, which is laparoscopic resection is better than endoscopic dissection for gastrointestinal stromal tumor between 2 and 5 centimeters, a case-match study in a gastrointestinal center. I have nothing to disclose. Background: the feasibility of the endoscopic dissection for gastric cyst between 2 and 5 centimeters has been demonstrated by some doctors. However, its impact on short-term and long-term outcome compared with laparoscopic resection remains unknown. The purpose of this study was to compare short-term and long-term outcome between laparoscopic resection and endoscopic dissection for 2 to 5 centimeter gastric cyst. Method: a case-match study was performed using a propensity score. To overcome selection bias, we perform a 1-to-1 ratio match using 5 covariates, include age, gender, ASA score, tumor location, and tumor size. Inclusion criteria include age from 18 to 80, and AS score 1 to 3, and tumor size between 2 and 5 centimeters, and pathology confirmed gastric cyst. Exclusion criteria include a patient refused surgery or adjuvant organ invasion or distant metastasis. Results: totally 210 patients with 2 to 5 centimeter gastric cyst were enrolled between 2006 and 2017 in our GI center. According to intention to treat, 165 patients underwent laparoscopic resection and 45 patients underwent endoscopic dissection. Of the propensity score, 45 pairs were balanced and analyzed. This is a flow chart. So both endoscopic group and laparoscopic group had 45 patients after propensity score matching. Results: no significant difference in the baseline characteristic between two groups. The rate of complications was significantly higher in the endoscopic group. The post-operative hospital stay was significantly longer in the endoscopic group. No significant difference between two groups in disease-free survival. This table 1 shows baseline characteristics, include patient demography and tumor characteristics. Before match, the endoscopy group has small tumor size, and after matching, both two groups no significant difference, and also no significant difference between two groups in age, gender, BMI, ASA score, and tumor location. Table 2 shows surgical outcome between two groups. An endoscopic group has longer post-operative hospital stay and more complications. The most common complications in endoscopic group was perforation. In the endoscopy, doctor they use endoclip and keep a suction tube. Table 3 shows pathology between two groups before match and after match. There are no significant difference. About disease-free survival, no significant difference between two groups before match and after match. In conclusion, laparoscopic resection is better than endoscopic dissection for 2 to 5 centimeter gastric cyst because of lower complication rate and short hospital stay. Thank you for your attention.